Hello and welcome to another corporate showcase. My name is James Whelan, Managing Director of Barclay Pearce Capital's Wealth Management Division, joined here by the head of Invion Limited, Thian Chew. Invion Limited, with their next generation PDT technology, focused on killing just cancer cells and activating the immune system in comparison to chemo and radiotherapy being what's known as a carpet bomb. We're going to go into that in just a second. Also, if you want to value them on other companies, they are undervalued compared to other companies as well. We will get into that too. First off, I'm going to introduce Thian Chew, head of Invion Limited. As I said, Thian, how are you now?
Good, James. How about you?
Really good to talk to you, though. We don't get enough chances to catch up. Now, you mentioned undervaluation versus other players in the market when we were talking earlier today. Just wondered if you had a chance to go into that.
So if you look at the statistics, 1 in 1,000 companies actually even get to a phase 1 clinical trial. Once you get to a clinical trial, 1 in 10 get approved. Those are the statistics. That's why when you've got a company that's at clinical trial stage, it's significantly de-risked versus something at an earlier stage. And we're about to move forward and commence a number of clinical trials in multiple cancer indications, which is essentially where the biggest unmet need in R&D and in healthcare is right now.
It's going to be exciting to see what comes up out of that, and I will be following that quite closely with my clients as well that we have and our advisors in that too. Now, you've just had a recently published activity report. I'm going to let you continue the show here and talk to it because you definitely know the details about that, but it seemed fairly positive from what I'm reading here.
Well, it's been an interesting quarter, and it's really a culmination of all the things we've been working on for the past couple of years. And one of the items is we're essentially on the cusp of essentially starting our first clinical trial, which is in non-melanoma skin cancers. We are waiting for the ethics feedback, in which case we'll be ready to go shortly after that. So I think that's certainly one of the catalysts that investors look for. The second catalyst or second interesting update was we'd done some work with the Peter MacCallum Cancer Center on combining our therapy with a type of immunotherapy called checkpoint inhibitors, which is essentially the main blockbuster drug in cancer today. It accounts for billions of dollars of revenue, and when they work really well. The problem is that the response rate's typically not that high. It can be as low as 12% or lower. And what we did with Peter Mac was we found that the standalone arm was consistent with industry at about 12%. But when we did it in combination with our PDT, we increased that to 80% response rate. And this was done in a mouse model using a anal squamous cell carcinoma model. Which we were pretty excited. Peter Mac is really excited. So we're looking to integrate some of these outcomes into our, upcoming clinical trials. And hopefully we could increase and improve the response rate for the ability to activate the immune system when fighting cancers, because that's ultimately where you can get sustained sort of regression and tumor sort of treatment.
Excellent. And I believe there was a collaboration announced.
Yes, there was as well. So this was actually outside cancer, and this is actually outside the cancer compound we're using, INV-043. We have a portfolio of about over 300 novel compounds, and we signed with a South Korean company called Dr. IMB, which actually has experience with PDT as well. They looked at our data, they liked what they saw. And basically, they committed to funding and running a development process in Korea with gynecological hospitals and looking at doing proof of concept clinical trials for HPV virus, which is it's actually the most prevalent STD, highly prevalent in this part of the world.
Yeah, and it sounds like good progress in that regard as well, especially with the collaboration. Now, the process for skin cancer trials coming up. The expected start date, maybe not be so specific, but
yeah, look, we're hoping. I mean, we have submitted to the ethics committee. We have a site, we have a protocol. We're kind of just raring to go, but we do need to get the thumbs up before we can move forward. And we're hoping we're relatively not too far away from doing that.
I'm looking forward to seeing that kick off and then the results that will come after that as well. confident. So thank you for joining us, Thian Chew of Invion Limited, for this corporate showcase. Anyone who wants to know more about the story, please contact myself or any of the links that we're going to be posting on this one when it is released. And generally speaking, please feel free to reach out because this really is a great story doing some amazing things. The technology that they have, the PDT, is phenomenal and really needs to be known about how much more advanced I believe that it is, and the initial testing has shown that it is. So really is a good one. Thank you very much for joining us, Thian, and I hope you have yourself a good afternoon.
Great. Thanks very much, James.